I'm off my soapbox now.
Okay.
Let's move on. Now, when I talked about this next segment, you thought that I was going to be upset with this. And this segment is about Texas physicians pushing for med spa regulation. And so that picture there is from the last segment that we did on this. I think it's the one before. Yeah, here we go. That should be the title one. Yeah, it takes so. And the second picture, Travis, the reason I had that one is there because we talked about this incident.
Yeah.
This is the girl that died from the IV therapy. Do you remember that?
Okay. Yes, I do.
Was it like a year ago or was it last summer maybe? It was almost a year. So there's been an update to that, sort of.
There was like something in it, right?
Right. Yeah. We'll talk about it. So a Texas physician group is now pushing for greater med spa regulation in our state. The group is Texas 400, TX 400. I've never heard of this group. It's an organization that wants to ensure patient safety and transparency in medicine. So I'm like, oh, that sounds like good things, right? I'm all about patient safety. I'm all about transparency. And this new push to regulate med spa is due to that incident that we talked about a year ago, where a patient named Jennifer Cleveland died from an IV treatment at a med spa because the IV bag, which was supposed to be just like hydration fluids and vitamins, actually had TPN. If you remember, TPN is the solution like when you're getting fed through your vein.
Yeah.
So it's got lipids in it, it's got a bunch of electrolytes, and it's something that generally is given over a long period of time, and they slammed it in her, and because it has electrolytes in it, I'm pretty sure this is correct, I'm kind of just going from memory
absorbed.
Here. Yeah, it caused her heart to go into arrhythmia, and she died because there's potassium in it, and they gave it too fast. And it's like, why in the world were they given TPN? That's insane. That, and a lot of people.
Why is that? That's not normal to have it at med spa.
No, absolutely not. No, TPN is like what people get. Like, say you're like in a bad car wreck and you're in a coma.
Yeah, that's what it's for.
Yeah, they can't feed you in your stomach. Or if you have pancreatitis, for example, like the way you treat pancreatitis is you don't stimulate the gut, and so they feed you through your veins. That's what TPN is. I mean, and not to mention that TPN is white. Like, I don't know how they got this mixed up. Like, the IV bags are either clear or sometimes they'll have like a yellow tint because of the vitamins. But like TPN looks different because of what's in it.
Yeah.
Although maybe it's changed now. I don't know. Maybe it's not. I remember it being pretty opaque. Like, it was obvious it was TPN because you could see it hanging. It's like, oh, that patient's on TPN.
Yeah.
So I'm really not sure
weird.
How that they messed that up. But, it comes from that there's not a lot of regulation.
Yeah.
So the Texas 400 says that there is too little regulation of med spas in Texas, and it's the Wild West, this was their quote, with very little supervision. And I absolutely agree with them. I do think that Texas, I don't think it's quite as bad as Florida. We're always dogging Florida about all the bad plastic surgery stuff that happens out there.
Down there.
Texas is not far off from Florida as far as the lack of regulation. And that has bled over into med spas. What?
It makes me laugh.
Oh, well, yeah.
We're not far off from Florida.
I know. We got to be careful, man. We don't want to get to that level.
We need to do better.
Yeah, we need to do better. Texas 400, which once again is this physician groups, thinks that medical directors are one of the biggest issues with med spas. And I just literally 2 days ago heard a story. I don't want to say who said it because I don't want to find out where this is. But I heard a story of a med spa that's opening and their medical director is a chiropractor. Does that make any sense whatsoever?
No.
Yeah, right? None. How can a chiropractor be a medical director?
Why is there any type of chiropractic services that are offered at a med spa besides massages? If there is, do you get massages at med spas?
I mean, you could have medical massage, but it's not common. No, I mean, med spa is generally medical treatments, Botox, fillers, lasers, microneedling, IV therapy. Like, these are medical treatments. When I heard that there was a chiropractor opening a med spa, I was like, what? How is that even possible?
That's very strange.
Well, and how is it even legal is like a better question. Well, it's because there's not enough regulation. And so Texas 400 is exactly right. Med spas offer medical treatments. This is not like going and getting your nails done. These are real medical treatments. Yeah. And the medical director, and this is just my opinion, the medical director should be the absolute most qualified person that does these procedures. So as you guys know, I run a med spa, and like prior to opening the med spa that I have, like we did med spa services in my surgery practice. Like, I'm always the one that people ask whenever there's a question, you know?
Yeah.
If there's a question about Botox, there's a question about fillers, a question about the lasers, the machines, like, I'm the one that has to know it. Like, I'm the one that should be the best at this. If you're a chiropractor, I mean, obviously, they're not going to have any idea of what...
You're just there because you have the word doctor in front of your name?
Exactly. And I would say that like bleeds over into, you know, and I'm not like dogging other specialties, but like if you're like a primary care doctor running a med spa, like what are you doing? I mean, you had zero training for doing these things when you were a resident. Like when I was a resident, we were trained how to do Botox, how to do fillers, you know, how to run the machines that we have, because it's part of plastic surgery.
Yeah.
You know, I would say that...
Your specialty.
Yeah, exactly. So, you know, I think that when you have a medical director of a med spa, they absolutely should be able to talk intelligently about these treatments, and they should do them. And that is not the case. I mean, you know, when going back to this case with that Jennifer Cleveland girl that died, you know, I don't know if you guys remember, when we talked about that med spa, the director of that med spa had been there a total of 2 times, I believe, ever. And one of those times was right after the girl died. Basically, this person who was an anesthesiologist, if I remember correctly, was running this med spa, but literally was just hands off.
Yeah.
And so it's like, well, no wonder there was a bad outcome. I mean, if the person is not there, if the person doesn't even, you know what procedures are happening, how can there be any safety?
Yeah.
So, you know, I think the next question is who makes good directors of med spas? You know, and I mean, this is going to sound biased, but I mean, I think the obvious answer, one, would be plastic surgeons, because we literally are taught how to do all these procedures.
Yes.
Like, it's literally part of our training. When I take my board certification, it will have questions about Botox. It'll have questions about fillers. It'll have questions about lasers. What other medical board has those questions? I think there only would be one, and that would be dermatology.
Yeah, that's the only other one I would
And
think
so
of.
I would say that, you know, if you're going to a med spa and it's run by a dermatologist, you're probably good.
Yeah.
You know, I'm not at all going to say that plastic surgeons are the only one that should be directors of med spas, but outside of plastic surgeons and dermatologists, I personally am not sure that these other doctors should be directors of med spa.
I feel like dermatologists, I would suspect that they have a limit on what they can actually do versus at yours, which is run by
Yeah, but I mean, to be fair, to be totally fair and objective as I always try to be, I mean, I think a dermatologist can literally do anything that I would do in a med spa setting.
Cool.
You know, I mean, like Botox, fillers, lasers. I don't know if they get as much of that in training. I'm not 100% sure that they get tested on their boards, but I think they do. You know, when I talk to dermatologists, they always seem pretty knowledgeable. You know, if I was going to have, like, if we were going to have med spa Jeopardy and you put a chiropractor and like a family practice doc up here, I'm going to annihilate them.
Yeah.
Like, because I mean, I just have so much more training and experience.
I would hope so.
And so, you know, well, that brings into the question of, okay, well, if that's the case, then should these people be directors of these things? I don't know. I'm not sure that they should, or if they are, they should have to do specialty training to do that, which there's no restriction whatsoever.
That's crazy.
I mean, I know all kinds of doctors that are running med spas and people that are my friends even, and I'm like, how do you know, like, how do you feel like you know this stuff?
Yeah.
You know, and they don't. They're relying on the nurse injectors and the estheticians that, you know, have gone and done these treatments to actually be the ones that do it and know about it. And that's crazy because ultimately they're responsible for these people.
Yeah.
You know, so it's like, how is that correct?
No.
So I absolutely agree 100% with the Texas 400 that we need more regulation.
Is it like, so how, like with that med spa, it's like, I guess they purchased that lipid solution that you're talking about.
Well,
it's like, is there any regulation on what a med spa business can like buy in terms of medical supply?
That is a fantastic question.
Because then they shouldn't have never been able to buy that.
How did they get that? And I guess
that should be at a hospital,
right? But
not at a
I would
med
say
spa.
that the way that they got it is the same way that somebody that's on home TPN would get it.
Okay.
You know, because there are patients. So the one that pops to mind immediately is pancreatitis. Like if your pancreas acts up, you don't want to stimulate it with food.
Right.
But you don't necessarily have to be in the hospital. I mean, you will initially, but after a while, you'd be able to go home, and you would want to take, you know, TPN, so that's total parenteral nutrition. Yeah, and so there's going to be like a pharmacy that creates that stuff, and that's probably where they got it. You know, it's probably
Weird.
the pharmacy where they were getting their IV bags for the stuff they should have been giving probably had TPN. They checked the wrong box, and there probably was a breakdown somewhere. It's like, you know, the place that made this stuff up should be, why is a med spa ordering TPN? No one asked that question, and so there probably was more than one breakdown. But you know, ultimately, when you have a director of a med spa that's not even there oversighting people,
Mistakes will happen.
yeah, mistakes are going to happen.
Bad ones,
I think the only
apparently.
reason there hasn't been like a huge outcry prior to this is that, to be fair, most of the stuff at the med spa has a low risk of death. You know, I think of the stuff that we have like in our office. You know, knock on wood, it would be hard for somebody to die from any treatment that we have in an office. Now, could you get jacked up? Sure. I mean, you could totally get botched if somebody, you know, wasn't paying attention or if they didn't know what they were doing. I mean, you can get burned with a laser or with a broadband light treatment, easy enough. But outside of like this rare instance with the IV, there's not going to be a lot of deaths from med spas. I think you have a lot of unhappy people. You know, people who get, you know, complications that are maybe not like life altering.
Yeah.
But, you know, I think that we have a duty to protect patients, and that doesn't necessarily always mean protect them from death. You know, you get protect them from bad outcomes.
Yeah.
And if you have people that are supposed to be directors who really have no idea what they're doing and not even there, how is that safe? So I'm on board with you, Texas 400.
Yes.
I'll advocate for you guys. Maybe I should. I don't join any physicians groups. Like, I'm not even a member of the plastic surgery physicians group. There's like the American Society of, wait, what is it? ASPS.
You're not a part
American
of the
Society
plastic,
Surgery. Yeah.
plastic surgery club?
No, I didn't join it. And there's only like, I think if you look at the data, it's only 8% of plastic surgeons don't join it, and I'm in that group because I just don't like buy into it. It's like. It's like some people like to be in fraternities. Like, I mean, actually, I was in fraternities, so that's a bad example.
Like, wait,
That's a bad example. But like, you know, it's like a club for doctors. I'm like, yeah, I'm good. Like, to me, there's just not a huge benefit to it. So yeah, I'm not in the AMA. I'm not in the ASPS. I just have zero interest in that. I was like, why was I even talking about it? Because Texas 400.
Yeah.
I'm gonna actually join them. I mean, you know, they actually are out there trying to do something that I think is important. So
yeah,
I may have to look
maybe.
into that one. So you go, Texas 400. I'm with you. More regulation on med spas. And also, you know, people out there, just be careful. I mean, if you're going to go to a med spa, it is worth looking into who is the director of that med spa. Like, look at their background. If you look it up and it's plastic surgeons, dermatologists, you can feel pretty safe that that med spa probably runs pretty well and that people know what they're doing because there's going to be a lot of oversight. If it's like a family practice doctor or a radiologist or a chiropractor, I personally wouldn't go there. I mean, that person really is not going to know all the things.
Psychiatrist.
Psychiatrist, yeah.
Yeah.
So yeah, if you're going to go to a med spa and you want to have a good experience, I think it is important to check and see who's running it. You know, it potentially can make a difference. So that's my speech, and I'm sticking to it.